coming up my neighbor's driveway finishing snow blowing, and the snowblower got caught up with some heavy wet snow, and I stuck my hand in the upper chute with a heavy rubber glove on, and the glove must have gotten sucked down into the snow because I went in straight, at least I thought I did, and it went down and damaged my first 3 fingers here.
The nature of his injuries, the index finger, the middle finger, and the ring finger were all fairly severely damaged by the auger in the snowblower, and each one was fractured into multiple fragments, so each bone needed to be reconstructed, and then the tendons were also lacerated or twisted and torn as well, so the tendons need to be reconstructed, especially the extensor tendons. And he also cut the nerves on the thumb side of each finger, so he had nerve and artery damage as well. And we had to reconstruct the fractures, and then we had to do microsurgical repair of the nerve and artery, and then also tendon repair for all 3 fingers. So fairly extensive, several hours worth of surgery. With the complex nature of Jeffrey's injuries, the rehabilitation is a critical component to his overall outcome and functional recovery. A rehabilitation protocol for an isolated tendon laceration is different than it would be for an isolated fracture. And since Jeffrey had lacerations and injuries to multiple structures, the rehabilitation protocol has to be fine-tuned according to how he's doing at each stage of healing, also as well as what stage the tendon or a fracture is healing, as well as the nerve and artery. You don't want to put a patient on stretch that would put tension across the nerve repair. You have to wait for the nerve repair to heal before you can fully extend the fingers and work on extension. Or if you're working on the extensor tendon, you don't want to flex the fingers too early because that would jeopardize the repair. But also, one of the most important things for hand surgery is that you have to have good communication between your therapists and your surgeons, which we have excellent communication here at the Hospital of Central Connecticut between myself and the treating therapists. And at each stage of healing, the therapy protocol can be altered or changed depending upon how the patient's doing.
Rehabilitation started with Dr. LeGeyt's office. His therapist there started with, I believe, ultrasound and massaging and exercising and using different pieces of equipment to get strength back in my hand and movement. So it, and I said, Doc, I need to water ski. So that's what we did. And it took probably a full 6 months to get use of it, and then I had to get strength back after that also. I would recommend Dr. LeGeyt for anything to do with the hand, the arm, etc. He's been wonderful with me, and the therapist has been great. I'm very happy with him. And very personable and easy to get along with, knowledgeable, lets you know what to expect and what you can do and what you can't do. I can't say enough about it, really.
We try to treat every patient as if they were a member of our own family, and we try to provide for them the same level of care that we would want if it was one of our loved ones that was injured. And I think we do a fairly good job of that. Not only, in my office practice, where our 6-month rolling average for satisfaction is 98% or higher for the last several years, but also the nurses at the hospital, the therapists at the hospital, the x-ray technicians, from the moment the patient gets to the hospital to the time that they're discharged. The entire staff at the Hospital of Central Connecticut is focused on that patient and providing the best possible and best quality care that they can provide. And I think they do an exceptional job at that.